Good afternoon, everyone, and thank you so much for joining the presentation today. My name is Jana Bitton, and I'm the Executive Director for the Oregon Center for Nursing. We are the state's nursing workforce center, and we are dedicated to helping Oregon be healthier by providing information that informs policy and collaboration that creates meaningful change in the nursing workforce. In March of this year, we released our report titled Primary Care Workforce Crisis Looming in Oregon. We released this report mostly because we wanted to better understand how nurse practitioners provide primary care in Oregon. We know that nurse practitioners are educated and trained to provide primary care, and there has been a dramatic growth in the number of nurse practitioners in the recent years. Of all states, Oregon is well-placed, is well-positioned to utilize nurse practitioners in primary care for two main reasons. First of all, Oregon is one of 23 states considered a full practice state, and that means that state licensure laws permit nurse practitioners to evaluate patients. They diagnose, they order, and they interpret diagnostic tests, initiate and manage treatments, and that includes prescribing authority. And also, the second reason is there's a significant evidence that there's a lack of physicians in rural communities of Oregon, and that results in gaps of primary care coverage that could be filled by nurse practitioners. The American Association of Nurse Practitioners has stated that about 70% of practicing nurse practitioners currently provide primary care, but in Oregon, only about a third of practicing nurse practitioners report a focus on primary care. So we released this report back in March, but our timing of this report was very unfortunate because only 10 days after we released this report, Oregon shut down due to the pandemic. However, we realized that this information is extremely important, and we wanted to make sure that we followed through and raised awareness. As we look at the pandemic and we start to look at different, as our state continues to reel from these multiple public health crises, we still need to be aware of the important role that nurse practitioners can play in everyday foundational health and the role that primary care providers are going to play as we continue through the pandemic, as the pandemic continues on. So we brought everybody together today for this presentation just to let you know a little bit more about what we found in our findings. We're hoping that this also gives you more of a context about how how nurse practitioners are providing primary care in our state, which is a full practice state, and also give you the opportunity to ask some questions about our methodology and our findings so that it can inform your policy and future and research in the future. Before we begin, please keep in mind that there's a slide deck available on the handout tab, and this is a pretty small group, so this may take an hour, or it may take just a little, it may take 30 to 45 minutes. It just depends on how many questions you have and how long it takes to get through the information. You are welcome to submit any questions to the chat box anytime during the presentation. And after our presentation is over, we'll have a Q&A session. And with that, I'm going to turn it over to Dr. Rick Allgeier, who is OCN's research director. As the research director for OCN, Rick coordinates our research agenda. He ensures that the information on the nursing education supply and projections for future demand are available on a regular basis. Prior to joining OCN, Rick was the director of strategic decision support at the Texas Health and Human Services Commission, and in this role, he was responsible for analytic and quantitative research on healthcare utilization, demographic trends, and enrollment patterns for the state's healthcare and human service programs. Rick received his doctorate of philosophy degree from the University of Texas at Arlington in 1995, and he's been with the Oregon Center for Nursing now for about 4 years. So with that, I am going to pause my camera and turn it over to Rick, who is not going to show his camera, so he can just pay attention to the slides. So Rick, let's toss it over to you.
Cool. Thank you, Jana. Good afternoon, everyone. As Jana said, my name is Rick Allgeier. I am the research director at the Oregon Center for Nursing. And so what I want to do today is I want to talk about and walk you all through this study that we just completed on looking at the role of nurse practitioners in primary care here in Oregon. One of the leading one of the reasons we did this study is because we have heard through multiple sources that Oregon and a lot of other parts of the country as well are facing a shortage of primary care providers. And in light of said shortages for primary care physicians, a lot of people that deal with workforce in healthcare have been arguing that nurse practitioners are in a perfect position, especially in full practice states, are in a good position to fill the gap between where the primary care physicians let off. And so what we wanted to do is we wanted to just examine to see what the capacity of Oregon's nurse practitioner workforce in terms of delivering primary care was. We had gone through much of the literature looking at how to assess the likelihood that a nurse practitioner is actually providing primary care. And so it isn't as simple as just looking at how they're certified or those kinds of things. You actually have to start digging into the data a little bit to look at one practice setting and what their specialization is. The literature suggests that those factors are very important in making determinations on whether a nurse practitioner is, one, able to provide primary care, and secondly, whether they're in a position where it's possible that they could provide primary care. All the analysis that we're going to walk through today, and all the analysis in the report, was conducting our licensing data from the Oregon Health Authority. Every 2 years upon license renewal, licensees complete a fairly in-depth workforce questionnaire, and the data came from those. We also did work with the Nurse Practitioners of Oregon organization early last year to work on their biannual survey of nurse practitioners. We're not presenting those reports, the results from that study here, but we did use them to corroborate findings that we saw in our study when we were looking at licensing data. Now, one thing I want to make sure that people understand is this is really a probabilistic model. We're looking to see which situations, what practice setting, what specializations are more likely to provide primary care from the nurse practitioners. We didn't go out and ask every nurse practitioner what they're doing, if they're providing or not providing primary care. So we're not going to, the numbers are hard in terms of proportions and such, but there are going to probably be instances where people are working in a site that may not look like it, which will make a little bit more sense as we get through the data. But I just want to let you know that there are probably going to be exceptions to what we talk about today, that there may be somebody in the hospital that actually is providing primary care. So it's a little grayer, but it'll give you a really good indication on how the state is set up in order to have nurse practitioners providing primary care here. So the first thing I want to do is I want to spend just a little bit of time just talking about nurse practitioners in general in Oregon. So these data look at the number of licensed nurse practitioners and practicing nurse practitioners. And these counts are people who hold a license for a nurse practitioner in the state. And as you can see, in 2018, we had just a little over 4,000 nurse practitioners. Of those, we estimate that about 3,200 are actually practicing in Oregon. You can also see that we're seeing the line just below the number of licenses also illustrates the growth rate. Keep in mind, this is a biennial growth rate. So if you wanted to look at annual rates, you could just take those numbers and have them give you an estimate. The average growth rate for licensed nurse practitioners is a little over 9%, 9.1%. And the annual growth for practicing nurse practitioners in Oregon is 7.1. The practicing rate, we to make a distinction between what license and practicing is, license is exactly what it sounds like. It's everyone in Oregon who has a license who holds an Oregon nurse practitioner license. We also know that not everyone who holds a license actually practices. Some people may have moved out of the state but retain their license, or they've retired or have walked away from the occupation for whatever reason, but they still hold a license. So we want to take a look to see of the total licensures, what proportion is actually practicing. So we estimate there's about 3,200 nurse practitioners who are actually practicing in Oregon. Now, what we're going to start doing is, again, this is all nurse practitioners. And what we did is we first looked at their common practice settings. This does not include all practice settings, but it includes the majority of where the majority of nurse practitioners work. And as you can see, 52, almost 53% of nurse practitioners are practicing in an office or clinic setting. Almost 15, a little less than 15% are practicing in a hospital. 6% are practicing in a primary care clinic. Little over 4 is in public health. Then you can see ambulatory care and educational research institutions. So what this basically shows is that nurse practitioners, like nurses in Oregon, like registered nurses, practice in a variety of settings. Some are conducive to primary care, some are not. When we look at what they actually do, in the renewal survey, they asked some questions about the job function of the licensee, and about 90% of the nurse practitioners practicing in Oregon state that they're actually practicing or their job function is actually as a nurse practitioner. A little under 5% are for a staff nurse, 2% are nurse educators, and you can see the rest where we have managers and administrators and nurse consultants. And this, again, illustrates that nurse practitioners can serve in multiple different kinds of roles that as a licensed nurse practitioner, but not all of them are actually serving or functioning as a nurse practitioner. And so what we're going to start doing now is, so if you look at, I went back to the slide deck just for a sec, because what I want to do is I want to point out that when we look at the number of people whose job function is a nurse practitioner, there's 2,710 of those. That number is kind of important because that's the group that we're going to start digging into. So according to the literature, you look at a variety of different kinds of factors. One is work setting, one is the specialization. There's also the first cut we took was based on the position. So in our survey, when a person checks that they were actually serving as a nurse practitioner or functioning as a nurse practitioner, they had 2 different options. The first one was they could just say they're a nurse practitioner that actually provides primary care, and then they can also state that they're a nurse practitioner that does not provide primary care. And that's the breakout that you see here. So the PNCP is the primary care nurse practitioner, and the other one is non-PCNP, which is the non-primary care practitioner. And as you can see, there's slightly more non-primary care nurse practitioners than there are primary care nurse practitioners. And they do differ a little bit in how they're growing. The primary care nurse practitioners are growing by about 7% a year, and the non-primary care nurse practitioners are growing by about 8% a year. And this is the same data just in graphic form. I found over the years, I like pictures. I can draw a picture. I can get a story from a picture a lot better. And so what you can see is both are growing. The primary care nurse practitioners are growing just a little bit less, but the non-primary care nurse practitioners are growing a little bit more, and there's just a little bit more, and then just more of them. Okay, so what we're going to do now is we're going to actually start breaking it down so we can start talking about the method we use. So one of the primary factors that is highly likely to produce nurse practitioners that are actually providing primary care is looking at the practice setting in which nurse practitioners practice. Some settings are not conducive to primary care simply because of the way the tasks are done. So what we did is we looked at the data broken down 2 different ways. So the first set of columns is the primary care nurse practitioners. The second set of columns are for the non-primary care nurse practitioners. And what you can see is 75% of primary care nurse practitioners work in an office or clinic setting, where only half of the non-primary care nurse practitioners work in the same setting. 5% work in public health for the primary care nurse practitioners. 3%, 3.5% work in a hospital, 2.5% work in a skilled nursing facility or in long-term care, and then just less than 1% work in ambulatory and urgent settings, emergency settings. So when we were going through the literature and looking, they were basically, the literature made the argument that, you know, nurse practitioners who are actually practicing in office clinic settings or in the primary care clinic are more likely to be providing primary care than do nurse practitioners, even if they say that they're a primary care nurse practitioner that work in other settings. So, like for instance, we have 42 primary care nurse practitioners who work in a hospital setting. Well, hospital settings, as do most long-term care facilities, aren't necessarily conducive to primary care. It's likely, or it's possible, that the nurse practitioner could be providing some type of primary care to the residents or the people who are admitted into the hospital or residents of a skilled nursing facility, but those services really aren't available to the population at large. And so what they basically argue is once you get outside of office clinic kinds of settings, that the likelihood that you're able to provide primary care drops off significantly. So in this case, what we're looking at is we're looking at about 3/4 of the primary care nurse practitioners actually work in a setting that's conducive to the provision of primary care. And then the non-nurse practitioners aren't, just simply because they stated during the survey that they are working in a nurse practitioner's function that does not provide primary care. The second we looked at was specialization. And so here is a list of practice specializations for both primary care nurse practitioners and non-primary care nurse practitioners. And as you can see by the specialty, I put an asterisk by the specialties that we consider primary care. You'll notice right off that the OBGYN and women's health is not marked. There's two schools of thought. In many instances, people would include OBGYNs as primary care providers because a lot of women utilize their OBGYN as their primary care provider. In this case, we chose not to do it. The literature that we were looking at typically excluded OBGYN and women's health nurse practitioners as providing primary care. And when we also looked at the breakout in women's health nurse practitioners to see who said they were providing primary care versus those who did not, the vast majority of them, in fact, 4 or 5 times more, said that they did not provide primary care than those who did. So we had 59 nurse practitioners who said they were a primary care nurse practitioner in women's health, but 253. So for that reason, we excluded them. Towards the end, I did calculate the impact they had when we go through all of the different factors, and it didn't really account for much. So I feel pretty comfortable that we left them out. Or excluded them from that analysis. But what you can see is family practice of the primary care nurse practitioners, they count for almost 60% of the nurse practitioners. Pediatrics is about 8%, internal medicine just a little over 7%, and geriatrics just a little over 6%. So what you can see is we're winnowing it down. So we looked at the position that the nurse had, then we looked at the practice setting, and now we looked at the specialization to try to understand how many nurse practitioners we actually have in Oregon. So this is basically the breakout when we looked at the function, the office setting, or the practice setting itself, and the specialization. So when we look at all those things, so what this data represents is the number of nurse practitioners by specialty, family practice, pediatrics, internal medicine, geriatrics, for only those nurse practitioners who are actually practicing in an office or clinic setting. And what you can see is 77% are in family practice, 10% in pediatrics, 9% in internal medicine, and 4% in geriatrics, which leads to 745 about 745 nurse practitioners who work in settings and have an appropriate specialization to actually be very likely to be providing primary care. So one of the things that we did next was actually do actually delineate and outline all of our adjusted methods so people can actually see how we winnowed this thing down from a little over 3,000 known practicing NPs to 745 and nurse practitioners who are likely to be providing primary care. And so you can see that once you take the position into account, we are accounting for 90% of all of our nurse practitioners. Once we look at the ones who talk about their primary role as a primary care nurse practitioner, we're accounting for about 40% of nurse practitioners, of the licensed nurse or practicing nurse practitioners. Once you hit the practice specialty, we're accounting for 31%, or practice specialty, sorry, accounts for 31. When you look at practice setting, that accounts for 29. And when you look at both practice setting and specialty, along with the nurse practitioners who state that they're primary care nurse practitioners, we account for about 25% of all practicing nurse practitioners are likely to be providing primary care in the state. This is really important in terms of seeing what the capacity in the state of Oregon is in terms of being able to have nurse practitioners who can and do or are very likely to be providing primary care. One of the couple questions that this does bring up is, one, is this really enough? Well, it's unlikely it is. And the reason we say that is because when we look at, so this is some data presented by the Oregon Health Authority, the primary care office. This is the primary care health profession shortage area designations for all counties and sub-counties service areas within Oregon. And what you can see from this is the vast majority of the state is in some form of primary care health profession shortage area. There's some geographic, there's some because low income or other risk factors like homelessness, low income, migrant farm work, and those kinds of things. And the reason that this is really important is because these data do account for the presence of nurse practitioners in the state, along with primary care physician assistants and physicians who provide primary care. And so with the current number that we had in 2017, which we did see some growth in 2018, as you can remember from earlier charts, again, because almost the whole state was considered a primary care health profession shortage area, we're basically kind of arguing that while we are in a position to, well, Oregon's in a good position because of our full practice status. And what that basically means is what Jana was talking about earlier, in that primary nurse practitioners in the state are authorized through licensure to treat, diagnose illnesses and prescribe medication if needed. So we can take full advantage of the training and nurse practitioners across Oregon. We just simply don't have enough. Excuse me. So because of the majority of the state is designated as a health profession shortage area, and we're looking at about 25% of nurse practitioners who have who are actually or likely to be providing primary care. The primary key finding from this data is even though we are set where we can utilize nurse practitioners to the full extent of their license, we just don't have enough of them. And as we've talked about in recent work that we put out, where we start talking about maldistribution, and what that is we are trying to change the framework, because people talk about nurse shortages and such, and having a nurse shortage is, well, it's obviously scary and very concerning to folks, but it doesn't really underline what's going on in the state. You just say, oh, we have a nurse shortage, and that doesn't tell you really what's going on. So what we're trying to do is be more precise in our language when we talk about the lack of nurses, and we're talking in terms of maldistribution, which means that nurses just simply aren't distributed equally or equitably across the state, either through geography. So we have counties that have lots of nurse practitioners or registered nurses, and we have counties that have very few. And even when you adjust for populations, you see big swings in the number of nurses and nurse practitioners across the state. It also indicates in terms of practice setting. So if you work in a hospital, nurses are more registered nurses. It's easier to find registered nurses to work in a hospital, say against another type of setting like a long-term care, where they have a little bit more difficulty getting nurses. So one of the things that we're looking at in terms of our nurse practitioners is we're seeing the same kinds of things. We're seeing that we have a population of nurse practitioners in the state who are fully qualified to provide primary care. They're just distributed differently. And if you want, we do actually have county by county counts. We did not include them in the slide deck for obvious reasons, because it's really hard to show that much information on a slide. But those data are definitely available in our report, and you can look to see where nurse practitioners are in terms of counties. The good part is, one is we are a full practice state, as Janice said earlier. We're one of 23. So we can actually utilize nurse practitioners to provide independent practice and be able to provide primary care in areas where they lack other types of primary care providers. Another good point for us is both, and we've seen this in our other excuse me, in our other license types. So we see that our nurse practitioners, our registered nurses are both growing at substantial rates. The population of the state's growing at about 1.1, 1.2%. And we have nurse practitioners that are growing at 7 or 8%. Our registered nurses are growing at 5 or 6%. So we do see really big growth in terms of practicing nurses and nurse practitioners in the state. So that's good. We're just not getting them into, or they're just not being in settings, or they're not having specializations or a job function that are conducive to providing primary care. So actually only about a quarter of our nurse practitioners that are practicing in Oregon are likely to be providing primary care. And that is, we did go through that pretty quickly. But if we have any questions, we can definitely take those.
Thank you, Rick. And Jan, I didn't know if you had any comments to make before we jump into questions. But if you do have a question to submit, you can do that via the questions tab at the bottom of the webinar screen, or top of the webinar screen, or side, depending upon which device you're using.
Great. Thank you, Rick. And thank you for sharing all this information. And keep in mind too, just like, you know, as Rick was saying, the distribution of nurse practitioners in primary care is really influenced by factors beyond just the educational preparation. There's a lot of reasons why that distribution of nurse practitioners and where they choose to work. That question of why is for future studies. That's for future research that we're going to be doing. And I think that's really important to know, because when policymakers are talking about like, oh, well, we don't have enough primary care providers, we really want to make sure that we can focus on this primary care and get healthcare out of an acute care setting and into the community. We need primary care providers. At the same time, we also need to understand this data. We don't have enough primary care providers in the state of Oregon, period. We certainly don't have enough nurse practitioners that are going to be able to fill that gap. So let's take a look at a different strategy. So I just wanted to make sure that got that in there. So Kelly, are there any, I'm sorry, Rick, if there's anything else you wanted to add?
No, but I do see a question
Okay.
And this kind of goes back to your last statement, Jana. So the question is there a correlation to pay scale in areas with the greater shortages? And the answer to that is we don't know. We didn't look at that yet. That is a very important question, because one of the things that kept popping up as we were going through through the analyses of this report is why? Why aren't more nurse practitioners going into settings or into specialization that's conducive to primary care? And we don't know. We just didn't look at it yet. So remember, this study is really just to identify and look at the capacity. We don't know why yet. When we were going through review, we had people tell us what they thought. So it at least gives us a set of hypotheses to work from. So the short answer to the question, is there a correlation between pay scale and areas with greater shortages? Don't know. Don't know. My guess would be there is, but I don't know. And sometimes our guesses are right. Unfortunately, occasionally our guesses are incorrect. The one thing that we did hear, and this is definitely something we'll be looking at, is when we looked at the nurse practitioner survey we did for the nurse practitioners of Oregon, we found that about 80 or 85% of all nurse practitioners in the state are employees. So one of the reviewers of the paper of this report actually suggested that because they're employees, they may not have a choice. They may take the position, and this happens to be a non-primary care position, and that was what available, and that's what they ultimately chose to accept. And so those are the settings in which they work. But that is probably true for some nurse practitioners, but probably not all. So we definitely want to go back and look to see what is some of the causative factors behind the selection to or not to provide primary care.
Right. Other questions?
But no, there was another question about indicating why NPs end up working in settings that are not conducive to providing primary care, but you just touched on that. So,
And one of the things we see with nurse practitioners is, especially in physicians as well, is you see a large chunk or a chunk of physicians who choose to work in a specialty rather than in primary care. And our guess is that's true here as well. I mean, the data suggests that we see a large chunk. But again, as we stated earlier, we don't know why that's so. We just know it is.
Yeah. So we're really excited, and thank you very much for joining us today and hearing about our latest report. I think that in the context of the pandemic, in the context of what our world is looking like right now, I think it's really important to understand nurse practitioner workforce in Oregon, so we can be very strategic and come up with effective solutions. Thank you again, everybody, for coming.